Hello everyone. I will be taking you through the uses, routes of administration, mechanism of action, and pharmacology of oxygen in relation to radiology. To kickstart my presentation, I'll start by giving you a general overview of what oxygen really is. So, oxygen is a naturally occurring diatomic, colorless, and odorless gas. It is made up of two oxygen atoms. Its chemical formula is O2. It is stored in cylindrical containers like the one shown in this slide. Moving on to the uses of oxygen in radiology. It is used in enhancing magnetic resonance imaging. It is used to decrease the volume of air-filled cavities, for example in patients suffering from pneumothorax. This greatly helps in the production of clear images. It is administered on patients that have cardiac or respiratory distress so as to keep them free from complications such as restlessness, difficulty in breathing, headaches, etc. during treatment. It is also administered on patients experiencing hypoxia caused by the development of tumors. As tumors initially grow in size, they are dependent on the pre-existing blood vessels to supply oxygen, hence there are regions that become hypoxic. Progressing on to the routes of administration. Oxygen is administered as an inhaled agent via nasal cannula. It can also be administered via a face mask. The face mask can be a simple oxygen mask, a partial rebreathing mask, or an air entrainment mask. The masks are designed to provide a fixed concentration of oxygen so as to avoid oxygen poisoning. It can also be administered as an intravenous or intraarterial fusion of well-oxygenated blood. This is whereby blood with sufficient oxygen is directly transfused into an artery or a vein. Moving on to the mechanism of action of oxygen. Simple molecular oxygen is weakly paramagnetic due to its two unpaired electrons. This paramagnetic property allows it to be used as a means of generating contrast on magnetic resonance images. Also, whenever oxygen is metabolized in body tissues, oxygen molecules combine with hydrogen molecules, making it detectable using an MRI scanner. Oxygen ensures normoxemia or a normal concentration of oxygen in the blood during cardiovascular magnetic resonance by improving the oxygen content leaving the lungs. Oxygen also reduces hypoxia-induced mitochondrial depolarization that generates reactive oxygen species by ensuring a normal concentration of oxygen in the blood. Proceeding over to the pharmacology of oxygen. Pharmacology is basically the science that studies the effects of chemical compounds on living species, especially the science of the manufacture, use, and effects of medicinal drugs. Oxygen binds to oxygen-carrying protein in red blood cells called hemoglobin. The amount of oxygen molecules bound to a fixed amount of circulating hemoglobin in the blood determines the overall oxygen saturation level. The oxygen delivery capacity is regulated by the Bohr effect. In the systematic circulation, oxygen acts as a vasopressor, which means it causes constriction of blood vessels that eventually causes a rise in blood pressure. Oxygen decreases the work of breathing in patients with respiratory or cardiovascular conditions, which may prevent respiratory and muscle fatigue. It is metabolized in all tissues of the body. Normal healthy individuals have an oxygen blood level of about 95 to 100%. When that level is pushed above the baseline, It leads to hypoxemia or excessive oxygen in the bloodstream. Lastly, going on to the effects of excessive oxygen in the bloodstream or oxygen poisoning. It causes a lot of coughing. It can lead to respiratory distress. Oxygen poisoning damages the alveoli. It results in complications such as absorption atelectasis, hypercarbia, and tracheobronchitis. If severe, excessive oxygen in the bloodstream can lead to death. This is all that I had. Thank you.